Are you tired of staying at home? Tired of wearing your masks? Tired of social distancing? Well, there's a new concern from doctors, that thing called quarantine fatigue.
Our mental health is challenged. The stress levels are up.
In an exclusive interview earlier today, Channel 9 spoke one-on-one with the Mecklenburg County Public Health Director, Gibby Harris.
She said the virus is not going away anytime soon, knows this can all be exhausting. She says the rules we've been living with are just going to have to be part of your everyday life for now. Our Genevieve Curtis is live tonight, and Genevieve, Harris has been the most authoritative voice in our community, at least, on the virus and dealing with it.
Yeah, absolutely, Scott. And we are 5 months, almost 5 months into this pandemic. But let's be honest, it feels a lot longer than that. And County Health Director Gibby Harris says that she feels that too. And while we have to change our routine, she says it's also time that we change our mindset.
Exhausting.
We all feel it, the coronavirus fatigue, and Public Health Director Gibby Harris is no exception. But she says the key is to understand this virus isn't going away anytime soon. So now we have to accept that life is just going to have to be different for a while. Harris says it's the same type of adjustment society had to make when it came to tobacco use and wearing seatbelts.
It's just hard. It's hard work. Most people aren't real keen on significant change, right? Change is hard.
There are societal norms that have to change, like wearing a mask, which takes getting used to for everyone, including Harris.
There have been times when I've walked out of my apartment into the parking deck and realized when I got to the car that I forgot my mask. I have to go back in and get it. You know, I didn't see anybody during that quick walk, but at the same time, it didn't, you know, I forgot it. I have to go back and get it. So I think it's learned behavior.
Harris says we all have to think about our interactions in social settings.
Unfortunately, people have masks on, but they're down here. You know, your nose is exposed. We're snuggling up close so we can all get in the picture, and everybody's mask is down here. And yes, that, you know, and it's those sorts of behaviors, I think, that put people most at risk, and they don't even think about it. It's just sort of a natural reaction.
Harris says we all want to be as normal as we can be, and there are safe ways to do that. Don't get together in large groups, social distance, and wear your mask when that's not possible.
You can still get out, you can still go places, you can still do things, and also recognizing the fact that this is not easy for any of us. And it won't be for some time. We need to be kind to ourselves and kind to each other.
And Scott, in talking to Harris today, she tells me when contact tracers are reaching out to people trying to pinpoint where they might have picked up the virus, they're finding that people could have picked it up from 3 or 4 different places just because of how active they have been without taking those necessary precautions. And she really believes if we take these safety measures seriously, we could see a decline in cases, and then we could get back to doing the things that we all miss doing.